So we moved from corporate governance principles to corporate etiquette, and that was Janet, giving us all the tips. Now let's talk about child survival and development. Child Survival and Development Organization of Nigeria, CSDon, is a non-profit, non-governmental organization established in 2002 with the primary objective of joining other stakeholders committed to improve child and maternal health care and the mortality rate in the country. They are here to enlighten us on the need to be aware of the dangers of cancer and, of course, other, things that they have up their sleeves. We have in the studio this morning a youth volunteer leader, Jennifer Odiaga. Thank you so much for being here.
Thank you for having me.
And the publicity secretary for Lakemi Alibalogo. It's nice to have you here.
Thank you.
Okay, so we have this discussion here. Tell us what CSDon has been up to all these years.
CSDon.
CSDon.
CSDon is one of our friends.
Right. So CSDon, like you said, is Child Survival and Developmental Organization of Nigeria. We were established in 2002, like you said, and our primary focus is helping children and mothers in Nigeria to reduce the mortality rate, and also helping with treatments with our child hospital, mother and child hospital in Calabar. We're also doing awareness for spina bifida. We focus on that, awareness and treatment for spina bifida. And we also have the Run for a Cure, which is directed in the raising of awareness and funds for people living and suffering from cancer, well, specifically children and mothers.
Okay, now let me go to for Lakemi. She's talked about, having mother to child, working with the mother and child hospital, and treatment of spina bifida. What more do you do in terms of awareness? Because as you know, treatment or prevention is better than cure.
Yeah, so what we try to do is we try to encourage women. We tell them that early detection is, cancer can only be managed properly with early detection. So we say for breast cancer, you should, if you think you're prone to it, even if you don't know that, or even if you don't think you're prone to it, self-exams, mammograms, especially when you get to a certain age, and with children as well. We keep saying this thing about the paracetamol treatment, which is, whenever a child is sick, the first thing you do is give them paracetamol. No, what we're saying is whenever you see any symptoms that are recurring, it's better to take your children to the doctor. Don't self-medicate. Always, go to professionals so that they can help you.
And this is quite important, because if you self-medicate, you never can tell. You may just be masking what's a bigger
exactly
picture.
The real issue. Yeah. So we're saying, don't do it yourself. Leave it to the professionals. They can direct you on what to do and how to treat yourself better.
And we also encourage young women, especially moms, to encourage your young children, once they're of period age, send them in to get the HPV vaccinations. They're not usually too expensive.
What
there are a lot of
HPV?
Human papillomavirus. No, so there are a lot of hospitals that are willing to do these treatments at really low cost, or at least NGOs willing to support. So find out around in your community, there must be an NGO or something that is going to help with the injection. It's 3 courses. You do it over the space of several years, and it helps reduce the risk tremendously for cervical cancer. It's one of the biggest.
Now, Kemi, from your experience, what kind of I don't know what word to use. Should I say diseases? Do you find more prevalent among children?
So in terms of childhood cancer, it's something to do with their cells. So I'm not a medical professional, but
you've learned a lot from working in this NGO.
Yes. So cancer of the bones for kids, I think because they're growing, their cells are multiplying at a faster rate than the adults. So what happens is that whenever there's an anomaly in their cells, it just spreads really quickly. So I think the bones is really
leukemia.
Common. Yeah. Yes.
And blood cells as well. Blood cells as well. What
about in women? It's
In
mainly
women,
breast, isn't
breast
it?
and cervical cancer. Breast obviously is more common, but cervical is becoming more prevalent. I mean, for example, in Nigeria, I think 14,000 women this year alone have been diagnosed with cervical cancer. So it's something that's actually getting really prevalent.
Of course, these are figures from the cities alone.
Exactly. These are figures from cities alone, not to talk more of breast cancer. People are dying at the rate of 74 people,